Hello, friends, and welcome back to Dr. A. Sajid. Happy Bank Holiday to everybody who's working in the UK. Today, I was going through the nice guidelines for acute sinusitis. It's a small topic. Thought I'd share with you guys so that it's easier for us to go together. When I looked into the guidelines, acute sinusitis started off with the types of sinusitis, and they put down a small little definition zone where they talked about acute sinusitis, chronic, recurrent, and complicated. According to the NICE guidelines, any sinusitis that is less than 12 weeks is acute. Anything that's greater than 4 to 12 weeks is chronic. Recurrent sinusitis would be greater than 4 episodes per year, and complicated sinusitis, we'll talk about it. It basically includes the intraorbital, the periorbital, the intracranial, and systemic complications, and the systemic illness as well. Once the NICE guidelines have talked about the types of sinusitis, it then talks about the causes, and the causes are quite simple. The most important one is the upper respiratory tract infection, which, according to the NICE guidelines, is about in 2 in 100 is of viral origin, which is why antibiotics aren't the most ideal choice to go forwards with. The next cause is allergy, and then it talks about obstruction due to um, some foreign particle, and then asthma. Once we've distinguished the types and the causes of acute sinusitis, it then talks about the diagnosis. This was possibly the most interesting part to me, and it was quite clear in how it wanted us to diagnose acute sinusitis. It says nasal discharge. Let's change the color on this one, be a little fancy. All right. So it talks about nasal discharge or nasal blockage plus facial pain or headache plus minus reduced smell. And I think that was quite clear. So nasal discharge or nasal blockage, with either facial pain or headache plus minus reduced smell. That gives us out the diagnosis of acute sinusitis on history. On examination, it talks about two particular findings. Number one would be palpation of sinuses would result in tenderness, and second would be to do anterior rhinoscopy, and the rhinoscopy would show that the nasal mucosa is edematous, it's inflamed and red, and we can see lots of purulent discharge there. It says that in terms of vitals, it would be important to get um, temperature, heart rate, and blood pressure just to support our diagnosis of sinusitis. Once it's talked about the diagnosis itself, it then talks about the treatment, and I liked this bit as well because it divides off treatment very openly into 3 bits. It divides into less than 10 days of symptoms, greater than 10 days of symptoms, and then the complicated sinusitis bit. Now, when it talks about less than 10 days, this is where reassurance comes into play. And you'd want to tell the patient that it resolves within 2 to 3 weeks, and that only 2 in 100 patients are the sinusitis due to a bacterial origin. In most of them, they're viral and they wouldn't need antibiotics. You'd want to give paracetamol for in case they're striking fever. And this bit is the biggest controversy, which would be nasal salt irrigation, which seems to be easily available in the US, is a very salty solution that one can put in one of the nostrils. And if we push it with pressure, all of the congestion and all the purulent discharge from the other nostril just comes through. According to the NICE guidelines, we can refer them to the pharmacist who can think about the salt irrigation for our patients with acute sinusitis. Patients with greater than 10 days are simpler to manage, so they would need nasal decongestants, and which would be basically nasal corticosteroids, and that would be for 14 days. And this is where our knowledge comes into play. It could be plus or minus antibiotics. And you can also do, the NICE guideline talks about how you can do a delayed prescription of antibiotics. So if a patient doesn't need antibiotics at that point in time, you can give a prescription that if it doesn't get better in 7 days, you can pull out a delayed prescription of antibiotics for sinusitis. So less than 10 days would be reassurance, paracetamol, and symptom control with salt irrigation. Greater than 10 days would be either nasal corticosteroids or antibiotics at that point, or with a delayed prescription. Complicated is basically any sinusitis that presents with systemically severe symptoms, intraorbital, periorbital, or intracranial complications, and in that case, they would need the hospital. So that's sinusitis in a bit. I'm just going to take a screenshot for the thumbnail of the video, and then we'll talk about two more things that the NICE guidelines talk about. Number one would be the choice of antibiotics, and secondly would be when does an infection sound bacterial. So according to the NICE guidelines, if the symptoms last greater than 10 days, if the symptoms are severe, the discharge is purulent, there's fever, there's severe pain, and there's raised CRP, that's when we'd want to think about bacterial sinusitis. In terms of the treatment, the antibiotic of choice first line would be penicillin for 5 days. And if the patient is allergic, then we'd want to either look into doxy or Clarithrol. Second line would be comoxiclav. And this is the interesting bit. They've talked about the definition of second line antibiotic, and they've said if the first one does not affect, had it been taken for more than 3 days, we can switch it to second line. So if we've taken penicillin for 3 days, symptoms are not improving, patient is not feeling better, we can switch it to comoxiclav. Allergic to penicillins, it goes with doxy or Clarithrol. So that's my take on the acute sinusitis NICE guidelines. Hope you guys liked it, and we'll be studying chronic sinusitis together, hopefully in the next session, and slowly um we'll start covering as many guidelines as we can. If you haven't liked, subscribed, or commented, please do so. Have a nice day, guys. Bye.